Meadow, Campbell, welcome to the Anatomy and Clay Learning System podcast.
Thank you so much, Mark, for having me. I'm excited to be here.
We are excited to get to know you a little bit. I just kind of reached out because I saw some things online and we were so impressed with how much passion you have brought to just so many different aspects of the anatomy conversation, and definitely want to find out more about Meadow Campbell.
Yeah, I do love it. I'm glad that that comes across because it's something I am passionate about. I like sharing that with students because it kind of wins them over a little bit. And I think that's half the battle sometimes when you're faced with a huge structure list or, maybe a dissection that you're not quite sure about, is if you can kind of find some joy in it or kind of connect it to something, then I think it helps a little bit. So I'm glad that that comes across because I do love it. Anatomy and histology, which is again something that's not everybody loves, but I do. I love all the pinks and purples of histology. I love kind of interacting with the body at that micro level and connecting that with what we know from the gross lab. And so I've always found histology just as much fun as anatomy. So
that's great. I definitely want to ask you about histology because that's a topic we don't really talk about too much or enough. Before we go back and find out just your roots and how you got into all this, tell us where you are right now and what you do.
Oh, yeah. So I am an assistant professor at the Center for Anatomical Science and Education, and that is within the Department of Surgery in the School of Medicine at St. Louis University in St. Louis. So that's a lot of mouthful, but basically I teach anatomy and histology full time, kind of 3 trimesters a year, all year long. And so I just joined here almost a year ago. So I'm really enjoying my new St. Louis home here at SLU. So that's what I do on a day-to-day basis.
Yeah. How many students, what size classes do you have?
Well, it depends on the time of year. We have 3 different classes. So like right now we have our first year medical students. And so they're a class of about 185, somewhere around there. So that's a lot of faces staring back at you when you're working on stuff. Yeah. In the summer, we might have about 65 to 70. And those are some allied health students like PT, OT, athletic training, that type of students taking their very first graduate anatomy class. So they're a lot of fun to work with. And then we do PA students in the spring, and they're about 70 students too. So it's quite a few students coming through the lab on a yearly basis. And I love interacting and teaching with this to them all year long. It's really fun.
That's great. That's great. Wow. So let's go back. I always find it interesting, to discover when those first sparks went off. I'd love to know if you were sort of science oriented from a very early age, or if there was a key moment that really just, galvanized you and said, anatomy is going to be it.
Oh, that is a great question. So I guess not to go too far back, but I wouldn't consider myself being super grounded in science from the beginning, except that I really wanted to be an astronaut when I was a kid. And I went to space camp twice, and I had workbooks, and I did all of the kind of things that looking back on is like, oh, well, I kind of do that kind of nerdy type stuff now. It's just in different discipline. But so I originally went to college, and took some community college classes while I was even still in high school. And I took this intro to anthropology class. And to be honest with you, I had never heard of anthropology. I had no idea what it was. But I was instantly hooked to, anthropology is the study of people, past and present, and they're all different facets of people. So from their culture to language to biology to the cultural material things that people make. And so I just got sucked in right away. But it took me a couple of years to find and kind of consider like, okay, well, that could be a thing that I could do. So I went and got, I was enrolled at Wichita State University. Wichita is my hometown in Kansas, and they have a really great anthropology department there, especially one person in particular, Dr. Pierre Morianson. And he's one of those like just captivating professors that just sucks people in, whether you like it or not. And he's exciting to listen to. So I kind of gravitated towards him, and I was working full time. I've always kind of worked full time. at the time. And he was like, maybe you should come work in my lab as a master's student. And I was like, oh, I don't know about that. I wasn't sure. And he said, well, I can offer you an assistantship, So I was like, okay. So thought about it and decided to go ahead. And so I pursued a master's in biological anthropology. And with Dr. Morianson, his program is very forensic anthropology oriented. And so he does several forensic cases throughout the year, and he's very insistent on involving his students with that and getting hands-on learning with
Wow.
that. So he would do things like, here's a tray of bone fragments, sort them. Or here's a tray of bone fragments and tell me everything, give me an inventory of siding and kind of all the, what we call the osteobiography based on someone's skeleton. Tell me what if, is this a male or a female, or how tall might they have been, that kind of stuff. And it came to me very naturally, osteology did. And I was like, okay, well, this is kind of interesting. And like I said, he's kind of dynamic. And through him, I got to do a lot of very interesting things that I know I never would have got to do otherwise, not just the forensic cases, but we set up a decomposition study facility when I was there with him. We got that off the ground to kind of study the process. And again, it's a forensic context. So study the process of decomposition in a medical legal forensic context. So that was kind of cool. And then, sorry, go ahead.
that alone right there, I just need to stop you real quick.
Yeah.
So can you explain what that is? Is that where you're going out regularly to observe?
Yeah, we would do that sometimes.
Okay.
We got called to go out with Dr. Morianson several times, actually. He was one of those people where the police would contact him when they'd have someone of unknown, they didn't know who this person was, like an unidentified person, and they'd want to know kind of some basics so they knew kind of where to start looking. And so he would always say, I don't want to know what you think, because I'm going to do my analysis and I'll tell you what I see, and then we'll work, in the between. And so the very first thing that we would do is take an inventory of the skeleton, because what that tells you is, are you dealing with one individual or multiple individuals? Because there was one case in particular where the police kind of thought they were looking for two people. Well, we found evidence of 3 mandibles. So right away, we knew that we had an additional person. From there, you kind of move to, again, are we dealing with someone who is most likely male or female? And again, kind of stature or ancestral background, just to kind of help them hone in and kind of help their search. And we'd go out and do what we would call field work, surveying on someone's property. Say someone has, there's lore or something, they heard a rumor or something that somebody's buried somewhere. So we would go out to that property and do basically archaeological survey, but we're looking for a clandestine burial in that case.
Wow.
So yeah, we did a lot of that.
Wow.
Just random stuff. You'd be surprised what pops up in that context.
Wow. Okay.
Yeah.
That's a really cool specialty to get involved with.
It is. And it was nice because, the ultimate goal is to try to figure out who this person was so that their family can get closure and kind of complete whatever, legal process needs to happen. And Dr. Morianson was a big part of that. I once watched him testify and decided that wasn't what I wanted to do with myself, was to be on the stand necessarily. So I kind of chose, plus I love teaching and I knew that early. And so I decided to kind of go down that route.
Okay.
Here I am.
Yeah. So what was next from there?
Well, through him, I got my master's in anthropology, in biological anthropology. And again, very osteo-centric, a lot of human skeletal variation stuff. And then from there, you got to kind of pick like, well, you really need to go get a PhD is kind of how it was, especially back then, to do it. And I knew I wanted to be a professor. So I decided, okay, I need to go to grad school. And that got me to Southern Illinois University, Carbondale, SIUC down in Southern Illinois. And I started working with their biological anthropologists there. At the same time, Dr. Morianson was doing a bioarchaeological field school in Drowskow, Poland. And so this was kind of in that first year in doing my PhD, and I was still connected with him. And so we went over to Poland in one summer and spent 2 months over there doing what we call bioarchaeology, which is basically archaeology of biological remains. And it was a very interesting cemetery in this case. There was a cemetery that was eroding out of a farmer's field. So he'd be plowing and, tending his crops, and bones were coming up out of the ground. I know it sounds funny, but there are a lot of forgotten cemeteries all over the place.
Yeah.
And so
Yeah.
this was one of them. And he wanted the land as farmland. And so he called in some bioarchaeologists, and I was one of them. I got to be a TA on that one. So we went out there, we spent 2 months. It was a really, really interesting site. That region of the world has some very interesting lore and burial practices. And this archaeological site had 3 different components in it. It had some Bronze Age components. It had
Wow.
some Roman era remains. And then most of it was from a cholera epidemic that swept through that region in 1830s, 1840s. And so
Wow.
most of them were from that, but we found, some giant urns with cremains in them. So someone had, died and they'd been burned and turned into cremains and then put in this giant urn. And so we sorted that out. And even things like, oh, well, how many, that is a little bit of a challenge, even for the best osteologists, to kind of sort through burned remains, but we did our best. We found a lot of coffins. So sometimes you find the wood from coffins. And so we found some of those. But one of the most interesting things that came out of that cemetery was what the Polish archaeologists interpreted as vampires, or evidence against protecting from vampires as these people were being buried. And so we found things like giant metal sickles on their chests. And
Wow.
it was explained to me that way, if they were to come up and, resurrect themselves, so to speak, they would cut off their head. So that was interesting. We found several large boulders that were placed on the necks, either to hold them down or to protect the neck. We found several things like that, and evidence of vampire burials, or quote unquote, or protections against vampires. So that was something I'd never encountered, and I don't think you would encounter in North America. So very, very cool cemetery to get to work on.
Wow. How big?
Yeah.
How big an area was this?
That excavation unit was 20 by 10 meters. So 20 meters by 10 meters. So it was a decent size excavation pit. And we went down at least 2 meters, and it was very sandy soil. So that got to be an issue. The longer it sits out, sand likes to, collapse. So we had to be very careful in that way. But what we found, like, especially since most of that cemetery was the cholera cemetery, is that people are being buried in a hurry. Vampire and all that stuff aside, they were being buried in a hurry because people were dying kind of rapidly. And so we would find them. Normally cemeteries are laid out and it's kind of planned. This was not that. People were kind of all over the place and in different directions. About half of the individuals in this particular summer were infants or young children, which, infant mortality and that kind of child mortality back then was not uncommon. So that ratio, unfortunately, was kind of expected. And that's what we found. About half of them were juveniles remains.
Wow.
So just kind of an interesting, again, very interesting thing to get to work on.
Yeah. Wow.
And I think about it all the time because it was kind of a crazy thing to get to live in Poland for the summer and do something like that.
Right.
Yeah.
What an interesting combination between the anatomy side and the archaeological side.
Absolutely. Yeah. I, at that time, wasn't even into anatomy yet. So this was still just kind of my forensic osteology type stuff. And just, again, kind of trying to develop, like, who were these people, and try to figure out just the basic demographics of the cemetery. And then it wasn't until after I came back, finished some of my basic coursework for my PhD, that I started thinking about, I study especially long bone and cranial morphology. And I started thinking about, well, what causes bones to be a certain shape? And genetics is part of the answer. some of our environmental influences are the answer, but also what we do with our bodies. And so I'm talking here about muscles pulling on bone that then remodel the bone into a particular shape. And so I was long familiar with that process, but I never studied soft tissue ever. And so I was like, I got to get in the lab and figure this out. And so at SIUC, they had a kind of new certificate of anatomy. And I was like, yeah, because I don't really want to go back and change courses completely. Let me just see about the certificate. And so I've often described it, it's like a master's degree without writing the thesis. It's like kind of a 2-year thing, and you had to teach and do all that stuff. And so that's how I got into the anatomy lab and into the histology lab. And kind of like with the osteology, it just clicked. Like I won't say it was easy, because I worked my butt off and still do, but it just came naturally and I loved it. And once I got the chance to start teaching it, I think one of the things that my background as an anthropologist has helped me in my day-to-day life now is recognizing patterns and kind of seeing things that are similar. And what that does is help me identify patterns to teach them to people. Kind of like, I won't call it a hack, I don't really like that word, but there are ways to kind of lump up information and do less mental work and less memorization, and just start to kind of what I call, intuit some of this stuff, or use your power of discernment to kind of work it out. So that leads me, here where I finished up my PhD at SIUC and started teaching anatomy and histology right out the gate.
Wow.
I've been very lucky in that way.
What a fascinating journey.
Definitely.
Yeah.
I can't believe it sometimes.
Yeah. So at what point did AnatomyLove come into this? When did you start working on that? And
yeah, so I had the genesis of AnatomyLove like way back in like 2017, maybe 18. And I was working a lot at the time, driving a lot, and just didn't have time to like do anything with it. And so thought about it for a long time. Just kind of, thinking about it. And then what really kicked it off is during the spring of 2020, when we were all experiencing, this huge upheaval of what I call the COVID era now. I was approached by TikTok to create a series of educational TikToks on anatomy, because they really had like a learn on TikTok push that summer, because so many educational things were moving online, and it was something that people could do. And I have to back up and say, since AnatomyLove wasn't really a thing yet, a presence yet at that time, I have to thank my sister for getting me onto TikTok, because I had no idea what it was at the time, but she is a very large crochet blogger. And I know that sounds funny to say, but she's a crocheter, and she's a big deal in that blogosphere. And they contacted her and said, do you know of anybody else? And she said, actually, my sister teaches anatomy and blah, blah. And so I spent, about 5 months of 2020 creating well over 100 TikToks.
Wow.
And that really got me into like, okay, I'm going to go all in and start creating anatomy and histology content that I hope looks good and gets people kind of excited about it. And so here we are. So it actually started on TikTok, which is a funny thing to say.
So you put out the videos on TikTok, but then you decided to also add to it a website. So there'd be some home base on the internet where you could capture.
Yeah. And because one of the things that TikTok is really good for are small snippets.
Yep.
And sometimes, I teach graduate level histology and anatomy. And so that was kind of a fun new challenge for me at the time, to be like, well, how am I going to distill this? And they kept saying, 10 seconds, 15 seconds. Like at the time, TikToks could be a minute, and they were like, oh, that's way too long. And I was just like racking my brain, like, how do I reach people in 10 or 15 seconds with hopefully some useful or interesting, anatomy facts? So that was a challenge. It's debatable about whether that was successful or not, but that led me to, I'd like to have a home that's mine, that I can kind of expand on some of these topics. And so that's where the actual blog and website was born from. as a place to home some of that longer form stuff.
Yeah.
Yeah.
And what was the reaction on TikTok? Did you end up getting a lot of followers? And
I did. Well, I guess, I mean, I don't know. I did. It was actually more successful than I thought. And I didn't really know what to expect. I had not been on TikTok at all before then. And so I didn't know anything about the platform, but they were really good with training and support and some like, weekly Zooms and things like that to try to help, because most of the people in this Learn on TikTok campaign were not TikTokers necessarily. We had to learn how to do it. And so they were really good about that. And I had several videos that kind of took off. And that was very interesting to watch. And what I learned was you can't always predict what's going to land and what people will connect with and what they'll think is kind of cool. And they ask all kinds of interesting questions, about that I hadn't even thought of. So I think that's part of it that kind of gets me sometimes. It's like, oh yeah, you think about different things by getting inputs from various sources. So it was interesting.
do you recall which of the videos drew some of the most attention?
I know exactly which one did. So I will back up and say that when, I'm recording these TikToks, in my house, and it was 2020. So everybody in the house is there, right? And so I sit down to record this TikTok, and it's about seminiferous tubules in the testes of all things. And I wasn't telling anybody that I was about to record this TikTok, but the TikTok starts out with me saying, let's talk about sperm. Because that's ultimately what seminiferous tubules do in the testes. And so I said that, and I thought the people in my house were going to lose it, because out of nowhere, I just said that and then continued on with my TikTok, and they were like, oh my God. So I had an inkling that maybe this was going to be a good one. And then that one was the one that got the most views, because it just, I don't know if people understand kind of, like, oh, they think testes or something like that. But, and also it's kind of a fun, interesting topic, I guess, within anatomy. So it's an important one, just like the rest of the body. We need to know just as much about all of our repro organs too. So that one definitely took off. That got some mileage. Kind of
That's
interesting and funny.
Are you still producing TikToks?
Every now and then so I had to produce a lot of them in kind of a short period of time. And it got to be a lot because as we started to kind of come out of the being at home all the time, then the driving came back in and the face-to-face came back in. And so it just got to be something where like, oh, I can't do it at that level, the same level. So I think I have a better balance now, just to be honest, where I can produce different forms of content, put them on Instagram, TikTok, Facebook, all the regulars. And that allows me a better work-life balance, I think. Yeah. So I do them still though, just not quite every day or a couple times a day like I was doing.
And how do people find you on TikTok?
Well, I think being part of that Learn on TikTok thing was a really good deal, because that was one of the hashtags that we as the TikTok creators got exclusive access to for a couple months. And it got promoted, I think, in their algorithm. And like I said, this was an era where everything was going to online. And so and TikTok was blowing up kind of at that summer too. And I think the two of those combined, because I wondered about that, like, is people really on a platform like that, to learn about anatomy and histology, and, because most of it's just fun, silly stuff. And I think that that's good too. But yeah, it got a little bit more traction than I would have thought, given just, the platform, but it was fun. It is fun.
Hey everybody, Dr. Campbell here with AnatomyLove. I'm going to run you through dural venous sinuses and their drainage patterns. These are huge veins inside the cranial cavity that drain the cranial cavity and the brain itself. I always start with the sagittals. We have a superior sagittal and an inferior sagittal sinus. Inferior sagittal sinus drains into the straight sinus, which drains straight into the confluence of sinus. It's a big one back here. A minute to talk about some innervations? I hope so. You probably know that skeletal muscles need innervation, right? Those are somatic efferent fibers that come straight out of the spinal cord and head straight to that skeletal muscle, cause you to walk across the room or firing up your beer drinking muscle. But did you know that there's a whole nother parallel efferent motor system that runs things like cardiac muscle, so the heart? Hey everybody, let's cover another tricky topic, compartments of the extensor retinaculum. It's down here at the wrist, and it really tightly binds all these extensors of the forearm and the wrist. There's 6 compartments with 12 tendons, but we can sort them out. Let's get oriented. We've got a radius and an ulna here, cut and cross section. Radius is always lateral, ulna is always medial, so we're looking at the posterior side with all of these bumps.
Well, the other aspect of your website is the, I don't know if you call them blog posts, but those detailed topics you decide to dive into. Are you still producing those on a steady basis?
I try, again, with like real job stuff gets in the way sometime, but I did actually just last week publish another one. This one was on the nasal cavity. I taught head and neck anatomy exclusively for several years. And so my background as an anthropologist who studied especially the skull a lot made me very well suited to that. And then like I said, I just love head and neck anatomy. And I think it's one of those regions that can be somewhat of a barrier to students because there is so much going on and there are so many clinical aspects to the head and neck. And it's such a great diagnostic tool that it can be a little bit daunting. And so my experience just really getting to dive into teaching a subject like that at the graduate level and trying to figure out, like how to make it accessible to people who may not have ever encountered what's the skull, and kind of move them from there to, I would hope, a very well-rounded understanding what's happening in head and neck. So a lot of my posts come out of that era and that experience of really diving into head and neck. But I've got like a sacral plexus post, things that again, they're just tricky ones, or ways, things that I think I could maybe break down and make a little more accessible for people.
They're really impressive. And where do the graphics come from for those?
Yeah, so that was actually kind of an issue when I started because, you got to give credit, and need to try to find sources because there's a lot of stuff where it's just a picture out of Netter or something like that. I love Netter, by the way, but I didn't want to just do that because that's out there. And so I went, and a lot of them come from Canva. I don't know if you're familiar with that, but it's a graphic site. So I pay for them on there. And they have actually quite a bit. And then I try to create like the drawings and stuff. Those are mine that I've just developed from years of teaching. Those I think are probably some of my favorite things on there, the ones that I've created myself, the drawings and just kind of diagrams and stuff. So
that's great. They're really impressive. I have to say.
Thank you.
Yeah. All right. Histology. We have to talk.
Okay.
It's pretty rare to find somebody who's super enthusiastic, but for everybody else out there, let's define it. Yeah.
Histology is the study of tissues under the microscope. That's like, the elevator speech about it.
Yeah.
And I was again fortunate to encounter a very wonderful human being by the name of David King, who was my histology professor. And then I TA'd with him for a very long time. And he has a very interesting way of approaching histology. It's not his primary research, actually, but he loves it. And that comes across when you're in the lab with him. And he, it's very elegant. He would describe it as very elegant. And I describe it as beautiful because it's all pinks and purples and maybe some blues and, and some other colors in there. But most of them are pink and purples. And I love purple. I have purple hair. It's my favorite. And so it just I didn't at the time when I first started, but I also just kind of appreciated, being in the anatomy lab and then getting to take, a slide of the kidney and put it on a microscope and see them at those levels at the same time and kind of understand the macro and micro structure, if you will. And so I think, again, something like the kidney is very elegant. I do think that students, in my experience, struggle with things like the size of things. Like it's hard. I think our brains have a hard time understanding, like, how big is this thing I'm looking at? So one of the things, again, I kind of developed some kind of rules for them, like, well, the smallest things that we'll see on our slides typically are red blood cells, and they're everywhere. So we'll see them. They're about 7 micrometers. So if you see one, okay, well, there's 7 micrometers, and you can kind of work out. Some of the largest cells that we see are adipocytes, and they range, but 50 to 150 micrometers. So I say about 75. So between those two cells, and red blood cells and fat cells are everywhere. They're on a lot of sides. So you can use them as a histological ruler to try to kind of figure out like how close you are in the zoom of things. And of course, stainings help because, you know, different properties of different cells stain either more or less with different dyes. And then slicing. Slicing is one of those things that I think students can sometimes get tripped up on, because if you think about like a straw and it's a nice linear thing and you cut it in the middle at an oblique angle, it's going to look like an oval. And you might not be able to extrapolate like, oh, that's a line. Or an even weirder one is like the glomerulus inside of a kidney. It's a little cluster of capillaries that are all wrapped up in a ball. Well, if you slice that, you're seeing lots of tiny little lumens of capillaries. And it's really hard to maybe kind of think about the three-dimensional aspect of it. And so that's where we bring in things like scanning electron microscopes or something like that, or anatomy diagrams, or diagrams that I've created for that too, to just try to kind of, again, create this kind of rich three-dimensional image, whether it be in the anatomy lab or on a micrograph.
Wow.
So I like the two of them together is especially powerful.
And you're teaching histology. Yeah.
Yep. I taught it all the time at my last job, and this time it's a little bit lighter load in terms of the histology teaching, but I still love it. I still get to talk about pinks and purples and all of the cool things that I'm always talking about. Remember when we saw in the lab, and here it is on the slide, and vice versa. So they might think I'm crazy, but I don't care. I like it.
Well, one thing that comes across really clearly scanning your blog and reading it is just how much you pay tribute to the teachers, professors who inspired you.
Absolutely.
So I'm wondering, you know, if you could just relate what you've picked up and gathered from all of the folks that you've worked alongside and worked under.
Yeah.
You know, what is the key to inspiring students around the topic of anatomy in particular?
Yeah.
Not just what does it take to get folks to really, you know, have that same kind of passion that you do?
Yeah, I have been super fortunate in the people that I've gotten to work the closest with, and they also have had a passion. It might not be for anatomy, but a passion for what they do, and that has always come across. I've just been very fortunate to have very good mentors in my life, and I think kind of their excitement breeds excitement, you know, and so that's one of the things that, and it feels genuine, and I think it has to connect with students.
Yeah.
So to be able to be in the lab with students and get excited about seeing something that honestly I've seen thousands of times, I'm always excited about it because I'm excited for them to see it. And a lot of what we do, especially in the head and neck and in other areas too, you learn it in a textbook. And I always say to the students, like, I bet you think we're making that up. You know, I'm thinking of something like maybe there's this nerve in the neck called the ansa cervicalis nerve, and we can go all on about it, but we can actually find it in the lab and dissect it. And when just to see that light bulb go off, and I get excited when I see it because it takes a careful hand to find it. So, you know, you got to hone your dissection skills a little bit. So man, when somebody pops one out in the lab and I get excited about it, they're like, oh, you know, and so I think that goes a long way. And not just in the lab, when I'm in the lecture hall with people, or we do recorded lectures now, I don't consider myself a funny person necessarily, but I do try to pepper little bits of humor in there, or puns, or just kind of talk to them like we're talking now, you know, that we don't, yes, we're going to be doctors and we will be serious about this stuff, but we don't have to be so methodical and just kind of, you know, base about it. Like we can have fun about this stuff and we can be creative. You know, mnemonics are a thing that the students love. So I'll ask them, you know, like, what's your mnemonic for this? And we'll share our kind of crazy ways to remember something. Just to kind of fun. One of the things that I love doing in my classes is I'll walk in and, they're maybe tired from the test that they just took before my class or didn't get enough sleep, whatever. And I'll just walk in and be like, all right, everybody shout out your favorite anatomy word that starts with S. And so people just start, hollering things out. And it's just kind of a fun way to turn your brain on and be like, oh yeah, I remember that. Or, oh, that's a good one. And then it just kind of gets people engaged. And I think that that's the biggest battle, because things like anatomy and histology, like if you're going to be in the medical field at all, you got to take them, and I think that can kind of lead to a drudgery for some students, and it doesn't have to be that way. And I think that when we as professors and professionals are excited about something, I do think that translates. Yeah. And I have students that I had years ago that still message me and like, oh, or send me little memes or something, or something that reminded them of our time in the anatomy lab together. So I don't know. That's being great. Infectious, I guess. Yeah.
Yeah. And speaking of infections, it's sort of interesting during the COVID years, how I think more of us probably stopped and thought about it, human anatomy. So, I think other than, doctors and people who are treating people. And sure. When you do tend to get sick, that's when you stop and think, oh, wonder why my heart is beating funny today, or why do I have a headache? But, do you think there should be more done in schools at an earlier age to boost awareness of our own bodies?
And absolutely. That's a great point. I think because it's empowering, especially for young people. And I think they're ready for it. Like maybe we don't need to talk about ansa cervicalis, as I mentioned earlier. That's kind of a detail that you can wait to med school for, but we can definitely talk about there's muscles in the neck that move the hyoid bone, and they can feel their hyoid bone, and you can show them kind of what a hyoid bone is and kind of talk about, even things, structures like the larynx, and we're using it right now to speak to one another, or things like that. And I think that that's things that, is accessible to even young children. And I think that children are inherently curious about these types of things, about their bodies, how they work. I used to do tours where we'd have high school students especially come in to the lab, and I would just stand at a cadaver and point things out, and even like the size of nerves, because some of them are huge, some of them are super tiny. Vessels, things like that. Their eyes were just, wide the whole time because they hadn't got that. And I think it was maybe a changing experience for them. And I think that not the earlier, the better for everything, but I do think that we could start. I took a biology class in high school, but it wasn't super in-depth, a lot, although it's been a minute. A lot of my students that I'm meeting now have done things like dissected frogs or cats or pigs or whatever, even in high school. So maybe it's happening. Yeah.
Well, it's the only thing we really own, right? We should understand how it works.
That's right. Yeah. And I think it would breed, a lifelong, not just, knowledge, but taking care of that body, right. And taking care of that instrument and kind of understanding and being an advocate for yourself when you need to be too.
Yeah. Well, as we kind of wrap up here, what's next for Meadow, Campbell, and you and your career? Where do you think this is all going?
Well, I've been at SLU now for about a year. I came in with some years at the assistant professor rank, so I'm going to try to go up for rank and promotion. So that will get me doing some more publications next year, working with my graduate students next year, who are also doing their own research projects that I'm really excited to work with them on. Lots more AnatomyLove posts coming out. So it's something that I work on all the time. So just trying to keep this out there, and be accessible to people as they need to for whatever anatomy and histology they need to know. So that's what's up next for me.
Great. Yeah. Well, Meadow, Campbell, it's been so much fun to get to know you a little bit, and
thank you, Mark.
Really appreciate watching your webpage. We certainly have it bookmarked.
Thank you.
And check it from time to time and see what's new with your world. But thank you so much for your time and for your insights today.
I appreciate it. Thanks for having me.